And so with that, it's our pleasure to have Mike Nance speaking today. Welcome, Mike Nance.
Well, I appreciate the invitation to speak, and more importantly, to talk about a issue that I've been interested in for more than 3 decades, and that's firearms and children. Whoops. I just offed myself. I have no financial disclosures. I'm a trauma surgeon. Nobody's throwing money at us. So why look at pediatric injury? If we step back, why look at pediatric injury? Well, it's incredibly ubiquitous. So 1 in 5 children are going to get injured each year, about 14 million. About 25% of trauma patients that show up in emergency departments are pediatric. So you may live in an adult world, but 25% of the trauma patients are pediatric. So it's hard to get away from them. 9 million ED visits, 250,000 admissions for trauma, 17,000 deaths, and that's the main thing. For those of you that like to monetize it, it's about $50 billion a year, and that's what it cost to wage a war at the height of the Iraq conflict in 2003. So the good news is that since I became a doctor in 1988, the mortality from trauma has decreased by about 50%. And I've got to give many others credit for that. I can't take all of it. The bad news, though, is there's a lot more room to improve things. So trauma is the leading cause of death in the pediatric population, more so than every other cause combined. So we still have a lot of room for improvement. So if you look at the leading cause of death in trauma, it's motor vehicle related. But number 2, so right behind, are firearms. So in the leading cause of death, the most common cause of death in kids is trauma, and the second leading trauma cause is firearms. So it's a pretty significant number of kids, and it's a pretty significant problem. If you look at it differently, for those kids that come into the trauma bay, the kid that's most likely to die from their trauma is that child that has a firearm injury. So looking at the case fatality rate, the case fatality is about 12% for firearms, and that's about 4 times higher than the next leading cause of death by mechanism, which is going to be motor vehicle related. So when that kid's in your trauma bay, you should probably be pretty worried. So if we look at an age group that's common to both of our centers, me perhaps at a pediatric center, and I suspect most of you at adult centers, these kids could go either place, so 15 to 19-year-old. Trauma leading cause of death, so not surprising, I've already said that. Homicides is number 2, and if we split that out even further, 83% of homicide deaths in this age group are due to firearms. And then number 3 on the list is suicide, and if you break that out even further, the most common cause of suicide death in this age group is a firearm. And so it's unbelievably commonplace. So 22% of all deaths in this list of top 10 involve a firearm. So 1 in 5 of the kids that die are going to die because of a firearm. And so it varies by state. So here in the middle is the U.S. average, and that's about 3.55 firearm deaths per 100,000. If you love your child and you want them to not die by firearm, then you should probably go live in Hawaii. There's probably a lot more reasons to go to Hawaii than just that, but it's down at about 0.5 firearm deaths per 100,000. Here's, I think that's because of the firearm death. And here's Arizona. Right here, it's about 4.57. So there's some room for improvement for all of you Arizonans. Is that right, Arizonans? I'm sorry if this one doesn't quite print out correctly. Each cell range is supposed to be a state. Here's Arizona. And so if you look at mortality deaths per 100,000, and then also by percent firearm ownership, what you see is the trend line, which is here, this dotted line. The trend is that higher ownership is associated with a higher mortality. So here's Arizona, which is kind of in the middle of the pack. This one was Alaska, as we saw. This one's Hawaii down here. Also in this lower block here are those states like New York, California, New Jersey, Connecticut, where you think of them as having fairly strong gun laws. And then also is Illinois, which is either this one or this one, I can't remember which. But Illinois gets a lot of bad press, mainly because of Chicago, where they say, look, here are all your laws, and they don't work. Well, Illinois, as a state, actually does pretty well. This is all the Gulf Coast states, Mississippi, Alabama, and Louisiana sort of fall in here. And I don't want to leave you with the impression that this is just a U.S. problem, except for the fact that it really, really, really is a U.S. problem. If you look at the 20 countries with the highest gross domestic product, that's like advanced, right? So the 20 most advanced countries in the world, here they are, with one exception. Here we are, the United States. So this is an American phenomenon. So I don't know how many of you are familiar with The Onion. It's a satirical publication, and this was one of their articles, and they say, there's no way to prevent this, says the only nation where this actually really happens. And so, unfortunately, this is sort of, I think, how we actually think, that we can't make the problem better, but somehow the other 19 countries have done a pretty good job. So to give a little perspective, all U.S. terrorism deaths, including everybody that died on 9/11, there are about 5,000 that have happened in the U.S. All AIDS deaths since 1981, when the epidemic began, about 658,000. All U.S. war-related casualties since we became a nation, 1.1 million. All U.S. firearm-related deaths since 1968, which was the Gun Control Act, trying to prohibit some of those cheap, easily obtainable weapons like the Saturday Night Special. 1.4 million people have died from firearms since 1968. So we don't need the British and the Germans and the Japanese, and we don't need Al-Qaeda. We do a pretty good job of killing our own. So just to put things into perspective. So mass shootings get all the headlines. And here are the mass shootings just since Barack Obama took office. So a pretty good clip. One of the ones that really got everybody's attention was the one in Tucson, Arizona, right? Is it down the road or up the road? Across the road. Over. Wherever Tucson is. It's the one in Tucson where 6 people died, including a young girl, and including a U.S. Congresswoman that was injured. So that got lots of attention. And President Obama said a national conversation is commencing. A little over a year and a half later, a gunman opens fire in a crowded theater, 12 die, and we're now having a broader conversation about how we reduce it generally. I'm not sure what that really means. Less than a year later, the unthinkable, 20 kids and 6 teachers are murdered in Newtown, Connecticut, and now conversation's over, I guess, and tears aren't even enough. And so we continue a little bit faster clip until June of this year, when in a racially motivated shooting, 9 were killed at a church in South Carolina. And President Obama reminded us that this type of mass violence does not happen in other advanced countries, and they continue to happen. And so children are not immune. Several of these included kids in Newtown, obviously, but many of these are mass shootings are murder-suicides. And so my definition was 5 people died, not including the shooter. The FBI has it at 4, but I couldn't fit 4 onto a slide, and it takes too much time. So I raised the bar to 5. But a lot of these are murder-suicides, so the kids are involved very frequently with these mass shootings. And when President Obama was interviewed in July of this year by the BBC, he said the one issue which has really frustrated him over his tenure as president, because he couldn't make any headway, was the gun violence issue. With all the stuff going on, gun violence was the thing that really bothers him. So this is obviously what we never want to see again. This is 2 days after the Sandy Hook shooting. We don't want to see a headline with 20 kids' names on it. But that's not the problem. This is the problem. It's the headlines that we see every single day, whether it's Philadelphia or whether it's Phoenix or whether it's Chicago. It's the day-to-day, drip, drip, drip of all of these shootings that really add up and are the problem. This is what we need to focus on. And so just after Sandy Hook, I was the chair of the trauma committee for the American Pediatric Surgical Association. We were asked to rewrite our policy on firearms and children. The last time it had been updated prior to that was 1998. column. Edited it through the trauma committee. It was approved by the Board of Governors, and that's usually where these kind of things stop. Most organizations write it and then archive it, and nobody ever looks at it again. The Board of Governors for this organization thought that this is important enough and controversial enough that it should be pushed to the membership to get looked at and voted upon. It was put up for a period of public review and then discussed and voted and had overwhelming support. Yes, there was some dissension, but it was very small, the dissension, and this was overwhelmingly approved. And so these were just the 9 statements that we endorsed, and I can't go through all of them, but I'm going to go through 3 of them, which I think are important from a pediatric perspective, and I think are important simply from a trauma perspective, things that are sort of make sense in the trauma world. So all of this has to be considered in the context of the Second Amendment, right? And so in 2008, the Supreme Court said what they feel about the Second Amendment, and that is that the right of the people to keep and bear arms shall not be infringed. They sort of, for all intents and purposes, kind of erased that other part that had to do with the regulated militia and that kind of thing. So this is how we have to consider it in this context. But in his majority opinion, Scalia said, like most rights, the Second Amendment right is not unlimited. It is not a right to keep and carry any weapon whatsoever in any manner whatsoever or for whatever purpose. So there is a little bit of wiggle room in those sort of food for thought. And so if we first focus on firearm deaths as a public health issue. So why is this not considered a public health thing? Why has it not gotten that kind of attention and focus? Well, maybe it's because it's been politicized. And so here is John Boehner, who's now our former Speaker of the House. He said, listen, the CDC is there to look at diseases that need to be dealt with to protect public health. I'm sorry, but a gun is not a disease. Guns don't kill people, people do. And when the people use weapons in a horrible way, we should condemn the actions of the individual and not blame the action on some weapon. The problem is that the CDC should be focusing on things that pose a risk to the public, right? And so that's why they look at motor vehicles. A motor vehicle is not a disease. Child abuse isn't a disease. A child safety seat isn't a disease. Teen drivers, maybe they're a disease. Poisoning isn't a disease. High school sports is not a disease. But the CDC funds those things. And so why aren't we funding firearms? It poses a risk to me and you. So when a public health person looks at this problem, they usually use a Haddon Matrix. Some may be familiar, but it breaks things down. Complex problem, hard to digest, and firearms certainly are a complex problem. Break it down into little pieces. You can look at the host, an agent, the environment. You can look at things that happen before the event itself, and then things that happen afterwards. The classic example is a motor vehicle, and I'll do that right quickly. You can look at the host and the pre-event thing, education, so driver's education, teaching kids how to drive safely. And then you can focus on the agent. The agent in this case would be the car. So what can we do to make the car better, safer? Well, collision avoidance things so that we don't get in an accident to begin with. And then things that happen at the event. Well, let's put an airbag in. So if you get in the event, you've got an airbag which might help. And then post-event, what can we do? Well, that OnStar thing is one of those things. So when you roll over in a ditch and you're upside down and then that little woman comes on and says, this is OnStar, I see that you've rolled over, can I help you? So there are things that we could do to help. And then modifying the physical environment, we can make the roads better, those little rumble strips on the side, so if you're veering off to the side because you're looking at your phone and sending a text, it tells you to stop doing that and look at the road. Social things, so DUI laws, so you minimize the risk of drinking and driving. The modifying the behavior of the person, so putting on a seatbelt to mitigate injury, energy dissipation, so those little water barrels that are at the fork when you're getting on getting an off-ramp, they've got those barrels, those are full of water, so you hit them, it dissipates a lot of the energy and helps protect you. And then here are the two where we live, and that's post-event, so the event has already happened, patients come to us, and we can improve our care. So we've done a pretty good job at improving care. And the other thing is the access to care, so getting a helicopter depot where it needs to be or getting EMS to the site faster. So why haven't we done that for firearms? So if you look at what's happened in the last 30 years, in part because of approaching this with a public health model, there's been a 20% reduction in motor vehicle deaths. At the same time, there's been an 8% increase in firearm deaths. So imagine if we had been using a public health model. But what we've done in motor vehicles is even more impressive if you think about the dramatic increase, 80% increase in the vehicle miles traveled over that time period. So in the last 5 decades, the mortality has declined from 5 deaths per thing, hadn't approached it, hadn't thought about it, then the motor vehicle fatality rate would be about 715,000 deaths per year if we hadn't done anything to try to mitigate that. Why aren't we doing that? Doesn't make sense. So I'm going to switch and look at mental health. So we have mental health totally wrong. So everybody talks about mental health in the context of the mass shooter, Adam Lanza, Jared Loughner. Those guys were crazy, but they got guns. So how do we fix that? That's not where the focus should be. The focus should be on suicides when we're talking about mental health, because suicides are responsible for 20,000 deaths, or 2/3 of firearms deaths. That's what we need to fix. And when we look at suicide overall in all ages, it's the 10th most common cause. If we look at our pediatric population, it's the 3rd leading cause. So it's a big problem. But there are approximately 25 suicide attempts per completed action. So, there is room to intervene and to help. So, only about 1 in 4 suicide attempts actually works, except if they use a firearm. If you use a firearm, 95% of the time it's successful. No room to intervene. Done. So why don't we work on that problem? So firearms were the cause of the death in about 50% of the completed suicides. So when it was resulted in a death, half the time it was from a gun. And counter to what most people think, 90% of people who survive a suicide attempt do not ultimately die from suicide. So the old saying that, well, they just find a different way is wrong. 90% who survive will not go on to kill themselves by suicide. So most adolescent suicides occur in the home with a firearm owned by the parents, so the access is easy. And many suicides are incredibly impulsive. They think about it, they do it. Think about your teenager. They think about something, they do it. So the impulse is there. And the other problem is that suicide mortality is not reduced with things like trigger locks and gun safes. And that's because many times you've told your child where the gun's kept, how to get it, because you want them to be safe in case there's an intruder. Well, unfortunately, it's a double-edged sword by telling them where it is and how to get access. So they may decide to use it. So one argument is that this is a big city problem, and if you look at the country and break it down, and we broke this down several years ago into the most urban counties and the most rural counties and all in between, there is no question that for homicides, the urban areas are much more at risk. And so this might be Maricopa County. And then homicides are way down here for the smaller ones, like Greenlee, something like that. Is Greenlee, does that sound small? Anybody here from Greenlee County? So it's apparently pretty small, smallest county in Arizona. So that would have a pretty low homicide rate. The problem is we also have suicides, and suicides are much higher in all of the counties outside of the biggest ones. And if you put these two graphs together and look at the U.S. as a whole and firearm issues as a whole, your risk of dying is the same whether you live in Greenlee County or a type of, like Greenlee, or whether you live in Maricopa. It's the same. Your risk of dying is the same. And so why do the legislatures in these places say, that's not my problem? Well, it is. So if you don't care that your constituents go behind the barn and put a bullet in their head, then it's not your problem. But it should be. So this is the risk of firearm death across the country. So I'm going to talk about firearms and research funding. How long do I have?
2 minutes, give or take.
2 minutes. So restrictions on research funding started in the early 90s. So in 1992, the CDC began the National Center for Injury Prevention and Control. One of the early studies they funded was by Art Kellerman. And what he found and published was that keeping a firearm in the home increases the risk of homicide by a factor of 3. The NRA hated that paper, suggesting that if you have a gun in your home, you're increasing your risk of mortality. And so he became an immediate target of the NRA, such that by 1996, Jay Dickey from Arkansas put an amendment into an annual spending bill that got rid of funding. And so what happened is it cut $2.6 million from the CDC budget. $2.6 million happens to be the exact amount that was appropriated for the National Center for Injury Prevention. Message? Yeah, I think so. And so the CDC was no longer funding anything firearm related. So CDC was not giving money. And they're the ones that give the money to the diseases and all that stuff, so it would have been the natural group. Well, research continued, but mainly through private groups and institutions and hospitals. So estimated 41% of gun-related homicides and 94% of gun-related private funding. Here's stuff from the Harvard Injury Control Center. So this is money from their center. Higher household gun ownership correlates with higher rates of homicide, suicide, unintentional shootings. Also from Harvard, more than 90% of suicide attempts with a gun are fatal, as compared to only 3% without. And then later in the 2000s, Charlie Brannis at Penn published an article that said people in possession of a firearm are 4.5 times more likely to be shot in an assault. NRA didn't like that. If you carry a gun, you're more likely to be shot and die in an assault. And so he had gotten his money from the National Institute of Alcohol Abuse and Alcoholism. This was an offshoot study. That's funded by the NIH. And so 2 years later, Congress extended this restrictive language to the NIH. And so now you can't get funding from the government. So here's how we fund other things. So here's cancer, and we fund it at the rate of $4,000 per year of potential life lost. Here's what it looks like for firearm deaths. $2.70. $4,000 for cancer, $2 for firearms. And that's not to say we're spending too much on cancer. It's a big issue. I'm worried about it. It's that we're not spending enough on the alternative. And so Barack Obama, just after Sandy Hook, issued 23 executive orders, including one that the CDC needs to research the causes and prevention of gun violence. Finally, reprieve. Problem is that who appropriates money? It's not Obama, it's Congress. So Congress didn't appropriate the money. So it sounds good, but it hasn't borne any fruit. So I'll wrap up. So children are not immune to the consequences of firearms. In fact, they're actually quite in the middle of the problem. We need to understand the problem to craft solutions. So if we don't do this research and public health stuff, we're not going to understand it. It's going to be hard to make a headway. We need to make incremental change, right? We didn't fix the motor vehicle issue overnight. It wasn't one thing. It wasn't car safety seats. It wasn't seat belts. It was a bunch of changes, little things along the way that made the difference. That's what we have to do in firearms. I think one of the most important things for this group is that we in the healthcare profession have a unique and powerful perspective on firearms. We should be sharing that. These are our patients. We know them better. We see the devastation from firearms in a different perspective than anyone else, than a legislator. They don't know it. To them, it's a number. To us, it's a patient. So there are other aspects. I didn't cover them, but CAPS laws, smart gun technology, gag laws, these are all things that we can touch upon as a community, as a country, that's not really impacting on the Second Amendment. It's not telling somebody they can have a firearm. It's trying to fix the problem. And we should advocate for change. We advocate for seat belts. We advocate for tort reform. Why don't we advocate for gun violence and firearms reduction, firearm safety? That is it. Sorry, I think I've run over a little bit.
I'd like to thank Dr. Nance for coming down to the Southwest and bringing his passion for a very difficult, complex, and certainly politically charged talk.